Welcome to Let's Talk Micro. Hello, my dear listeners. Welcome to another episode of Let's Talk Micro. As always, I hope you had a great week. And of course, you can always find Let's Talk Micro on Apple Podcasts, Spotify, Amazon Music, Good Pods, whatever you listen to podcasts, you can find Let's Talk Micro. As for our social media, I am on Instagram, TikTok, and YouTube as Let's Talk Micro, on X as Let's Talk Micro 1, on LinkedIn as Luis Plaza, and I have an email address which is letstalkmicro@outlook.com. So either via social media or via email, you can reach out with any suggestions, any feedback. Those are always welcome and appreciated. So please go ahead and subscribe to the podcast, download episodes, and if the app allows you to do so, please go ahead and leave a review. Thank you so much for the support. And of course, if you are looking to learn more about antibiotics, please check out www.learnantibiotics.com and the Learn Antibiotics book available on Amazon. These resources include cheat sheets, practice tests, games, and more, and they are being used by thousands of people worldwide and may be helpful for you or your colleagues. Definitely check them out. Great resources from Dr. Timothy Gauthier, a very passionate pharmacist. But having said all that, I really want to invite you to subscribe to the YouTube channel. It's growing, and as of right now, it is the episodes and maybe some shorts every now and then. But I will try to eventually do more videos and things like that. So I invite you to subscribe so it grows. I'm really grateful for your support. And one of the things with this podcast is, as I try to find great content, I like to go to conferences and things like that so I can connect with people, find different topics. So if you want to support the podcast in any way, because this podcast does not have any sponsors, you can do so via a Venmo link or via Buy Me a Coffee, KOFI. And both links are available on the show notes. Okay, so before we talk about this upcoming episode, the new episode, let's go ahead and talk about the previous one. Definitely, if you haven't checked it out, please go ahead and do so. It was a great episode with Dr. Amanda Harrington. And Dr. Harrington, she's a director in a lab in Loyola Medicine in Illinois, and she's also an educator. And she talks about that in the podcast. But she joined the Let's Talk Micro podcast to talk about certifications, specifically in certifications in microbiology from the ASCP, which is the American Society for Clinical Pathology. So those of you that work in the lab, you know that in order to work there, you need to be certified. So maybe sometimes people think, okay, I get a bachelor's in micro and I apply to a clinical lab and I can start working, and that is not the case. So in order to work in the different areas, and this is not only micro, right? So this applies to chemistry, hematology, blood bank, you need to be certified. And there are some agencies out there, but one very big one is the ASCP certification from the American Society for Clinical Pathology. And that is a national certification. And maybe we don't think about it much, but you know that when you go through the traditional medical laboratory sciences program, while you're taking the program, you're gearing towards taking that exam at the end. And you take it, you pass, and then you get certified. And if you go to one of those states that require a license, then they take that certification in order for you to get your license. So this certification is definitely very popular, and that's what Dr. Harrington came into the podcast to talk about. So you have that traditional certification when you go through that traditional MLS program where you get licensed in many areas in the lab. But in this case, and that's one way that you can be certified in microbiology. But then, Dr. Harrington came in and she talked about other ways that you can be certified. Because you have these categorical certifications where you can be certified in just one area. And she talks about how you can do that in micro. And of course, we also talked about the specialist in microbiology examination. She talks about the exam, what does that certification bring? I ask about the experience, which might be a worry for some of you that maybe you don't get to work in different areas of micro and might be restricted to one area. So I asked about that. But all in all, it was a great episode, so I definitely invite you to check it out if you haven't already. Okay, so let's go ahead and move on to today's episode. And this is one of those that sometimes, between all the support, some people maybe prefer the interview ones. Some people like the ones where I sit and talk about an organism. So this is one of the ones where I talk about an organism. So if these are the ones that you like, you're definitely in luck. And if these are not your favorites, I hope that you stay and listen because it is great content. And I appreciate your support. So today's episode is about Actinotignum schaalii. And this is the gram-positive rod. And those of you that listen to the podcast, the last time that I did an episode about organisms, I started going over gram-positive rods, and I did some about listeria, some about bacillus, some about corynebacterium. And I was at the microbe conference, the last one in 2024 this year, that it was in Atlanta. And I was talking to Paul Luthi from the University of Maryland. Shout out. He was a guest in the podcast with the Wolf Hartimonas Canoniclastica episode. And he suggested, why don't you do an episode, or maybe are you thinking about doing an episode about Actinotignum? And that is a great idea. That was a great idea, and still is. Because this is an organism that, now that we have MALDI in a lot of labs, we're seeing a lot more. And maybe the question comes in, is it a pathogen? Is it not? What do we do with it? So let me tell you a story before I start talking about the organism. Not a story, it's more like a comment, I guess, or, and it is about the pronunciation, because I was doing some research for this, and I found a video where it was pronounced Actinotignum schaalii. And of course, that brought the question, how do we pronounce it? I know in the lab we pronounce it Actinotignum schaalii. But then when I saw this video, I realized that it was from the UK, from the United Kingdom. And I know that they pronounce some things differently. And I know this when I talked to James and Callum from the Idiots podcast, which is infectious disease inside of two specialists. We talked about how they pronounce the cephalosporins and things like that. So they say, ceftazidime, cefepime, and here in the US we say cefepime, ceftazidime. So it was very interesting. So anyway, I asked the question, I reached out to some people, and I got the answer that we should pronounce it as schaalii, like sh. So very interesting. So shout out to Audrey Schutz from the Mayo Clinic, that she responded to my email. Thank you so much. Okay, so let's go ahead and talk about this organism. So I mentioned the MALDI-TOF before, and as you know, and I have talked about MALDI, I have talked about the things I like and I don't like, and the pros and cons. But we are definitely one thing that we are seeing, right? Now with MALDI-TOF, we are seeing the names of more organisms. We're seeing different names. So we are learning more. We are seeing all sorts of IDs. And of course, there are many reasons and factors that play into this. Of course, one of them with MALDI, you don't need as much organism. So you see a few colonies, you put it there, and you get an ID, hopefully, right? It also has a wider database of organisms. So you are expecting to see more names than your traditional systems, like your Vitek, for example. So it is expected and reasonable that you get more names. Now, when you get to other organisms, when you get to things like gram-positive rods, for example, and anaerobes and things like that, you need different cards, right? It's like if you're using Vitek, you need the A and C card. And for that, you need a larger suspension. Your McFarland suspension is larger. So typically, if you have a mixed culture where you have an organism and you have 2 or 3 colonies, that is not going to be enough for you to get an ID. So you have to subculture it and then wait maybe 1 or 2 days and then do that ID, set up that card where you need that heavy suspension, which is, 2.7 McFarland, and then another day for you to get that result. So with MALDI, you get those results faster and you need less amount. So then you bring in the type of sample. Sometimes when you get to urine cultures, right, and you're seeing, let's say, the gram-positive rod, and maybe you might think, okay, maybe it's lactobacillus and it is normal flora. And maybe you don't really go all out to identify it, maybe unless it's pure. So that might be a reason sometimes that now we're seeing more organisms. At least for that particular bench, those type of cultures like urine cultures, you might end up doing some sort of call saying, okay, this is your genital flora, and move on. So because, as I said, you don't have enough to do another method. So just to bring everything together and just do a quick recap on the MALDI, right? So you need less amount. The traditional identification system, let's say the Vitek system, for that you need pure growth, and then you need a lot more, you need a higher amount of organism. Your traditional gram-positive ID, gram-negative ID, they require a McFarland of 0.5. So there's a range with 0.5, starts at 0.5, that's the lower end. And then when you get to other organisms like the NH card, NANC card, even the yeast card, you need a 1.8 McFarlane. And then the ANC and the NH card, which, by the way, the NH card is the card that you use for Neisseria and Haemophilus and other organisms. So for those two cards, you need a McFarlane of 2.7. So as I mentioned before, in a traditional method, if you don't have enough colonies to achieve that suspension, you have to subculture your organism. And then once you have enough growth the next day, if it's growing healthy, then you can go ahead and set up those IDs. So with less amount and a higher database, we are seeing, bottom line, a wider variety of identifications. And one of those IDs that we are seeing is Actinotignum schaalii. So if you have a MALDI-TOF and you read urine cultures, I am sure that at some point you have had that organism. And of course, when you get that ID, the question arises, right? Do we report that? What do we do with this information? I am sure that some of you had to ask that question. And then the follow-up question, do we do susceptibilities on it? So these are great questions, so let's go ahead and talk about this bug. This organism was formerly known as Actinobaculum schaalii. Of course, right, the taxonomy, that's something that drives microbiologists insane. With all the changes, right, you learn one name and then all of a sudden you have another name. So that's what we do, right? But of course, I understand as more testing and you're able to do more things like gene sequencing and things like that, you discover that there are some differences. So organisms get reclassified. So yeah, it can be a little bit of a pain, but we deal with it. This is an anaerobic, non-spore forming gram-positive rod. And some of you are maybe listening and saying, hey, Lewis, stop. Wait a minute. Do you say anaerobic? But the urine culture, when you're in that bench, you don't have anaerobic media. You just have your traditional blood and McConkey, which can be either two separate plates or a biplate, right? Well, this organism is air tolerant. And just remember, as you think about, right, the air tolerance of organisms, and you have organisms that are obligate aerobes, you have some that are facultative anaerobes, so they can grow both in the presence of and absence of oxygen. You have obligate anaerobes that they cannot grow in the presence of oxygen. And then you have air-tolerant organisms. And those of you that work with cultures, you're familiar with this. Some great examples are Actinomyces and Cutibacterium. Those of you that read wounds, the sources that are wounds, on that bench, of course, you're going to see more organisms, right? And you know this. If you're typically, if you're reading urine cultures, you deal with Enterobacterales, using some Enterococcus, you see your urogenital flora. But then when it comes to a lot of non-fermenting gram-negative rods and some fastidious gram-negative rods, you don't see a lot of those. So when you're reading wounds, you have a wider variety. And one of them is Actinomyces. And while Actinomyces, it's an anaerobe, it's aerotolerant. So when you're reading cultures, you might be seeing it growing aerobically, maybe at day 2 or day 3. And just to make sure that we are all on the same page, maybe you're a brand new medical laboratory scientist, or you're a student and you're asking yourself what is day 2, day 3. So depending on the sample, the cultures, we hold them a certain amount of days. And then if nothing is growing, we discard them and finalize the culture as no growth. For example, when you have urine cultures, it's a midstream clean catch. For those after 18 hours, if nothing is growing, you can result them as no growth 18 hours. If you have catheters, those you keep for 2 days. But when it comes to wounds, those you typically keep for 3 days. So if after 3 days nothing is growing, you result it as no growth 3 days. And other sources like body fluids, those you keep for 5 days. Some cultures you keep them for 14 days. So having said that, Actinomyces, when you're reading a plate, you typically start seeing it growing aerobically about 2 days. And as I mentioned, another classic example is Cutibacterium. And those who, when you're reading blood cultures, and I have talked about this before, but you get a positive blood culture at let's say day 4, and only the anaerobic bottle is being flagged as positive, and then you get these gram-positive rods, and maybe after a day or 2, they are growing aerobically. So these organisms, they're air tolerant, so they can grow in the presence of oxygen, but at a reduced rate. So they're definitely gonna grow healthier anaerobically. And Actinotignum, while it's an anaerobe, it is air tolerant. So you will see aerobic growth, and that's why you're able to see it in the urine bench when you're reading those urine cultures. Well, as I said, it is a gram-positive rod. It is catalase negative. The rods can be straight or slightly curved, and even cocobacillary, and they may branch. As far as colony morphology, the colonies are small and whitish to gray. And according to the Clinical Microbiology Procedures Handbook from the ASM, American Society for Microbiology, they can be pinpointed at 48 hours. They grow very slow, and more than likely you might have the presentation in the lab where perhaps you see something growing but can't really tell. So in this case, they grow slowly, but this is a typical presentation that you have in the lab when you're reading cultures, whether you have a slow growing organism or maybe not enough time has passed since the culture was set up and it was placed in the incubator. But sometimes when we are reading plates, right, we can't tell if the culture is pure, right, if it's mixed, and then we kind of have to call it too young and then wait more, and then the next day, or if you do 3 reads a day, when it, like is the case in urines, maybe 12 hours later, someone can look at it and make a better determination, a better assessment. So this might happen in the case of this organism. And actually, while I was preparing for this episode, I subculture a strain for a picture. As you know, those of you that listen, I take pictures of organisms, I post those on social media, and I use them for the cover art of the episodes. So I incubated the plate for 3 days, and still the colonies were very small. So you'll be able to see the picture when I put it on social media. But as far as testing, let's talk about testing. As I said, they are catalase negative, but other testing includes urease, esculin, and nitrate reduction, which this organism is negative for all of those. And of course, I mentioned, well, you pretty much are seeing this a lot with MALDI-TOF. And one of the big issues with MALDI, right, is that people are not performing biochemicals or other testing, but you should definitely know these. It's always good to make the connection, and many things can go wrong when you're putting something on the MALDI-TOF. So it's definitely beneficial for you to know all the biochemicals and the reactions and the tests. It definitely helps you, believe me. So let's go ahead and talk about pathogenesis. Keep in mind that this is an emerging pathogen, and as more studies and evaluations are done, then we are able to get more information. It is seen in urinary tract infections, UTIs. So as I mentioned before, more than likely you'll see this popping on the urine bench. So let's go ahead and get technical and talk about some information found in the Manual of Clinical Microbiology from the ASM. And by the way, these are 2 great resources, which I've done episodes about both of them, so I invite you to check them out. And shout out to the ASM, ever since they came with the Wiley Online, where they have the subscription where you can have access to all the books online, the Clinical Microbiology Procedures Handbook and the Manual of Clinical Microbiology, the most current editions. It is a great resource, so I invite you to check it out. And that way you can have access to all this wonderful and beneficial information without having to carry books and go, pull the books from the shelf and things like that. You can have it with you. You carry your laptop, you're sitting on your computer. Let me look something about this organism. And it's so accessible, so shout out to the ASM. So according to the Manual of Clinical Microbiology, besides UTIs, there have been some cases of bacteremia, endocarditis, cellulitis, and gangrene, among others. But always keep in mind that it is an emerging pathogen, and that you get reports of these cases, but it's not something that you see all the time. But definitely with UTIs, that's where you'll probably see it the most. And when it comes to UTIs, you typically see them on elderly patients, but there might be some evidence that it may cause UTIs in pediatric patients. It also looks like this might be part of the urinary microbiota, so that also it raises another question about how significant it is when we find it. But of course, as I said, it is an emerging pathogen and we need more information. So one of the questions is, how do we identify it? And of course, MALDI-TOF is one of them, MALDI-TOF MS. And as I said, maybe this is what we're seeing more. But also the Vitek 2 A and C card that I mentioned earlier, it also can identify it. But as I mentioned, there are some challenges. For example, you need that full plate because you have to make a 2.7 to 3.3 McFarlane, and it has to be pure, which of course brings all this extra time that you have to subculture and then wait till it grows and set it up and get the results. So sometimes, as I mentioned with the urines, you might not go through all these steps. But the Vitek card can actually identify it, the A and C card. And now that we know how to identify it, do we report it? This is a great question. So keep in mind, one thing when you're working on reporting urine cultures is that the workup for some is dictated by whether they are pure and in significant amount. Take, for example, lactobacillus, that before, when you saw lactobacillus on a plate, right, you used to just do your little wet mount or your gram stain and you saw those long, thin gram-positive rods, and then you did a catalase and it was negative. And you will go ahead and report as your genital flora, right? But now, with newer, more recent guidelines, if you have a pure and significant amount, you actually report it as lactobacillus species. And of course, we all know what pure is, right? But that brings the question, what is actually a significant amount? What does that mean? Well, there might be some variability, but of course, there's a great table in the Clinical Microbiology Procedures Handbook. So let's go over that. For urines that the source is midstream or Foley catheter, a significant amount is greater or equal than 100,000 colony-forming units per ml. And then for in and out catheter, the amount is greater or equal than 10,000 CFU per ml. That's considered significant. And when it comes to suprapubic specimens, any growth is considered significant. So according to the Clinical Microbiology Procedures Handbook, if you have a pure and significant growth, then report it to the species level. So for example, greater than 100,000 CFUs per ml, colony-forming units of Actinotignum schaalii. And of course, this guidelines is pretty much what is used in the hospitals in the lab for the procedures. So always refer to the SOP as well, because as I said, sometimes you might have some variability depending on your patient population and things like that. So always check that as well. And then the last question when it comes to this, do you perform susceptibilities? Well, as far as that, you typically do not do those. I mean, if you get a request, consult with your director or supervisor to see what agents can be tested. Definitely, you can check the CLSI M100. And some agents that are recommended are penicillin and ampicillin, since most of these organisms, they are beta-lactamase negative. Okay, so let's go ahead and do a quick recap. So we pronounce it Actinotignum schaalii. And if you're in the United Kingdom, schaalii. But that was fun, researching about that and finding out how to pronounce it. So you pronounce it schaalii. It is primarily seen in UTIs, urinary tract infections, so you will see it in the urine bench. There are some studies that, it might cause UTIs in pediatric patients. You're seeing it in elderly patients. And depending on the amount that you have, if it's a pure and significant growth, you can go ahead and report it to the species level. And we went over the criteria that is considered for significant growth. Colonies are grayish white. It is an error-tolerant organism, so you will see it growing about pinpoint in 48 hours. And if you get a request for susceptibilities, make sure you ask your director or your supervisor, because more than likely you're not going to have a plan to do susceptibilities on this organism. Especially, a lot of labs, they don't do susceptibilities on anaerobes or error-tolerant organisms. That might be like a send-out. Or maybe you're able to perform some agents, but when in doubt, just ask. And keep in mind that it is an emerging pathogen. And if you are in a place that you have MALDI-TOF, more than likely, you are going to be seeing it. So make sure you keep it in mind when you're working that bench, right? So just put it in the back of your mind saying, okay, there's a possibility that I might see this organism. What do I do with it? And here's the information. And that, my dear audience, it's the end of this episode. I hope you enjoy learning about Actinotignum schaalii. Of course, I always enjoy sharing this information with you. Shout out to Dr. Paul Luthi from the University of Maryland for the suggestion, and I think it was time to talk about it since we are seeing it more and more. I hope it helps when you work in your cultures. So, this episode is very accessible. Keep it in mind when you have a question, listen to it. But definitely a lot of great resources. Check out your Clinical Microbiology Procedures Handbook and the Manual of Clinical Microbiology. So, stay tuned. Great things coming your way. Thank you so much for the support. I am so grateful. So please, continue bringing that passion to what you do. It's so important. You do such great work. So, of course, as always, stay motivated, stay safe, and of course, continue talking micro. Until the next time. Bye.